Hi, I'm Dr. Ian Martin, consultant gynaecologist here at McKeown Medical. Today I'd like to talk about heavy menstrual bleeding, what it is, how it can impact your life, and how we can help. Heavy menstrual bleeding means that your periods are so heavy that they disrupt your daily life. It can cause severe fatigue, impact your work and social life, and can lead to anemia in some cases. If this sounds familiar, no matter what you may have been told before, please know that this is not normal and you don't just have to live with it. There are effective treatments available.
Having to change clothes, having to change bedding, it was just something that was really impacting my happiness.
Our approach to heavy periods at McKeown Medical starts with a consultation to discuss your symptoms and how they affect your life. We then perform an examination, including an ultrasound scan, to check for any abnormalities such as fibroids or polyps that might be causing the bleeding. If we find a fibroid or polyp, we can often remove it during a procedure called a hysteroscopy. A hysteroscope is a thin telescope with a camera at the end that allows us to look inside the uterus, and if there's an abnormal growth like a fibroid or polyp, then we can remove it with the MyoSure device. If no abnormalities are found, we can offer an endometrial ablation with the NovaSure device, which is a highly effective treatment for heavy periods. We are very proud to be the first private centre in the UK to offer these procedures under local anaesthetic as an outpatient service, what's known as the ambulatory approach. This approach has been the norm in the USA for a long time, and we are excited to be the first to introduce it in the UK. This makes the process much more convenient. You can go home immediately afterwards and typically return to normal activities within a day or two without having to recover from a major anaesthetic. The procedure begins with local anaesthetic injections to numb the womb. Once numbed, the hysteroscope is inserted to examine the inside of the womb. If a polyp or fibroid is present, it's removed. If no other abnormalities are found, we can proceed with the NovaSure ablation, which only takes a few minutes. The entire procedure is usually completed in around 20 minutes. If you're anxious about the procedure, we can also offer IV sedation administered by a consultant anaesthetist. Whether you opt for sedation or not, we advise you to arrange a friend or family member to drive you home after your procedure. This approach is highly successful, with over 90% of patients reporting satisfaction with the outcome. Unlike the older approach of going straight to hysterectomy, these treatments help to preserve your anatomy, which is important for maintaining the natural support of your pelvic floor.
How would I explain how I felt then to how I felt now? I think that would be free.
If heavy periods are affecting your quality of life, please reach out to us at McKeown Medical. We're here to provide expert, compassionate care and help you get your life back.